Hello, good afternoon, everyone. This is Cortney Kesterson. I am the CAHF Disaster Preparedness Program Coordinator. And here with me is also Jason. Jason, you want to go ahead and introduce yourself?
Hi there, my name is Jason Belden. I'm the Disaster Preparedness Program Manager for CAHF's Disaster Preparedness Grant.
Alrighty, well, we're just going to get started then. So let's see here. Let me get the PowerPoint going. So again, we already introduced ourselves. So Jason, you sit on the committee that put together this exercise?
Yeah, so if you really like the exercise, you can thank me. If you hate the exercise, then we'll blame it on public health. So how's that? No, I'm just joking. The reason why we put this webinar together is a combination of things. It's true that I sit on the statewide exercise planning work group. It's us, the Hospitals Association, the Clinics Association, as well as all the, a bunch of the emergency response folks that you guys would normally deal with on an emergency or a disaster. So we have a lot of county MOACs that sit on the board. And folks from public health as well. So it's a collaboration of both response entities and folks in our healthcare industry. So with that being said, we realize that emergency management is not something you guys do in your day-to-day operations. So we wanted to put together a webinar that kind of talks about not just this exercise, but exercises in general, and how you can get that to count for your CMS testing requirements. And we'll go over the objectives here in a second. So we want to introduce you with some acronyms before we get started.
Right. And I also have a poll that we will put out sometime today, just asking who on the webinar is planning to participate in the exercise and if it'll be a tabletop, functional, or a full scale. So we will get into that in just a minute.
And we'll explain what the difference is between all those different exercises.
So these are some acronyms that you might see today. They should be spelled out in some of the documents, and then in all of our slides I've tried to spell it out as much as possible. But Jason already mentioned this person, the MOAC, the Medical Health Operational Area Coordinator. That is going to be mentioned over and over again in these documents that we cover today. So just a recap, that is each county has a MOAC and they coordinate with EMS and public health, and they're going to be your point of contact if you find yourself evacuating or if you need to be requesting medical resources from the county. So again, if you haven't seen our webinar objectives before, we'll be touching on these bullet points here. And since we've got a lot to do, I won't spend too much time on this slide. So
I'll explain the testing requirements from CMS, and I don't want to cast dispersions at folks, but this is something that CMS and public health have both jointly identified with us as an item that we definitely need improvement in. And I realize some of that has to do with, we just don't understand what the requirements are, but some of it is, we're not doing what the requirements ask of us, especially when it comes to full-scale exercises. And I'll explain that in a minute. So just to be clear, you're required to do two exercises per year for the CMS requirements. Both of those exercises can be full-scale community-based exercises, but it's not required to have two full-scale exercises. If you want, a second exercise can be in the form of a tabletop exercise, which is a narrative-based discussion of an emergency scenario. The best way to describe it is a tabletop, you talk through a disaster. In a full-scale exercise, you walk through the disaster. So when we say walk through, we mean you are actually taking the actions of what you would do during a disaster, whether that's simulating phone calls to the county, whether that's simulating activating your agreements with fuel providers or transportation providers. It's all those things. Do it just as if you were doing it during a disaster. That's the whole point of doing the full scale or functional exercise. So, and then on the end, we're gonna touch on this at length, but absolutely, one of the things that we've identified that we're deficient in, even if you have participated in the exercises, is we're not capturing that information in the form of an after action report. And in the language from CMS, that is one of the proofs or one of the methods that you should be collecting to provide proof to CMS that you've met this requirement. So.
Exactly. And on the next slide, we have kind of this illustration of what Jason was just talking about. So if you've done a tabletop before, but you haven't done something like a full-scale exercise, this is a common graphic you see whenever you go to any of these emergency exercise trainings. And here's just some pictures kind of illustrating the level that some people take it to. So you'll see that picture on the far right. Those people, they've even got like fake wounds. That's called moulage. So maybe, Halloween's coming up, you could get stuff like that.
Yeah, and just to clarification, the community-based full-scale exercise is different than a functional exercise. The community-based means that you are coordinating your activities with those of a response agency. Mm-hmm. So for us, that's going to be coordinating with that MOOC person, the Medical Health Operational Area Coordinator, or your healthcare coalition. So it'll be a combination of folks that you're exercising with. And then in turn, those folks from your local county are coordinating their exercise with the folks from the state. And so it's meant to be this top-down thing where everybody from the state all the way down to the individual providers are exercising the same scenario at the same time. Ideally, we want to identify gaps, not just for you, but for the counties and for the state. Like, where can we do things better? And that's the whole point of these exercises.
Exactly it. So again, here is kind of the definition of CMS's of what a full-scale exercise is. So this, I think Jason kind of already touched on a lot of this. So you're going to be simulating an actual response. It needs to be operations-based. So that's kind of that boots on the ground idea instead of just doing a discussion-based exercise. So this slide, it kind of is about the community-based element of this requirement. So again, you're expected to try and make contact with your local and state agencies or your healthcare coalition. We're going to be talking a lot about how to incorporate with that as we get to the actual exercise documents.
And yeah, and I did want to mention one thing, because some of you guys will be in counties that are activated, meaning they're in their command centers, they're doing some kind of disaster response because of the public safety power shutoffs, or maybe because of a wildfire. We don't know what's going to be happening in November, but my point is that you may be in a county that is planning to participate, and then some natural disaster occurs, which causes them to stop being able to participate. Unfortunately, that does not relieve you of the requirement of having to do a full-scale or functional exercise. It just would remove the requirement for you to do a community-based exercise, and it would now require you to change that community-based exercise to a functional exercise. Now, we're going to talk to you in a second about if you have to do your own exercise, or you don't like the scenario that your county is doing, you can certainly change that. And we're going to talk to you about what that process looks like for developing a community or a facility or a functional exercise and things like that. But I just want you to know, just even if your county decides they're not going to participate this year, doesn't remove the requirement for you guys to have that full-scale exercise. So.
Okay, so I would like to kind of just run our poll right now. Who here is planning to actually do a tabletop or a functional exercise? So let's just take just 60 seconds and see where everybody is kind of at here before we get into how to actually put together an exercise.
And one last thing on the statewide medical health exercise, and not just this year, but in general, you can use the exercise documents for both a tabletop and a functional exercise. Ideally, each county does that. they'll have a tabletop exercise based on the scenario that they're planning on using for the statewide exercise. Generally, that happens in the month or two leading up to the exercise. So you may go to a tabletop exercise that's sponsored by the counties, or you can do a tabletop at your facility with the same information.
Okay, so we're at about 70% polling right now. And it's looking like
almost like a third of people are doing tabletops and a third are doing the full scale. And then another 25% are doing functional exercise. So more than half of you guys are gonna try to use this as your full scale exercise requirement. And I think that's great. I really do. I think there's a lot to be learned from these exercises. And until we do them, you don't realize all the stuff that you'll figure out. You'll identify as you go through this.
Right, and that's why we wanted to make sure that we got this out at this time so that everyone has time to schedule your staff and take care of the logistics that we'll look at in just a second here. So step one, who's going to be your planning committee or your person putting together the exercise. And when we're talking about emergency exercises, this person is usually referred to as the controller or the facilitator.
Yeah.
And so you'll see that person referred to multiple times in the documents we're going to go over today. And again, just a plug for the few people that joined us since the beginning of the webinar. If you haven't looked at the handouts, please take a look at those and print out what's available there, because we're going to be referring directly to those when we get to the slides later. Okay, so back to this slide. So make sure that you are going to be testing something in your emergency operations plan that you've identified you want to work on. Since the statewide has already chosen a scenario for you, that part's already kind of taken care of. But as we kind of get into the objectives in this, you'll see that it really breaks down to whether or not you're going to be sheltering or evacuating.
And as we look at these steps, these are the exact same steps that the statewide work group goes through when we plan these exercises. We assemble a planning work group and we're going to go through all these things. This is exactly what we do. So if you want to create your own, this is the process to do it that will help you design it and create it.
Right, and just another note on the third bullet point here. So who will facilitate the scenario, and then who will be the evaluator. Sometimes that's the same person if you have a small team working on this. But the facilitator is going to be the one actually like reading the exercise, starting the stopwatch and initiating the exercise. And then the evaluator will be the one putting together the after action report afterwards. So it's two different functions, but sometimes it's the same person. And then the participants will be any of the staff that you've identified you want the exercise to test. So then kind of just a little plug for the regulatory requirement for that. All your staff needs to be trained on your emergency operations plans. So this is probably the time to start thinking about, which shift are you going to be testing, and do you need to bring in extra people to kind of cover for those people as they're going through the motions of this exercise. So we'll talk about that more again in logistics. Oops, let me click over here and then we will move on. So step 2, identifying your goals and objectives. So this is where you kind of start getting into how you can connect your exercise with the statewide exercise. So Jason goes to these meetings and has identified these objectives that SNFs and long-term care facilities really need to focus more on. And then they break down what that would actually look like. And they enter it into a timeline with all the other provider types so that we can get a picture of how the capabilities would work in a real emergency.
Yeah, and so I know a lot of people have questions about how we pick the scenario. Normally, what we would recommend when you're designing an exercise, let's say you're designing an exercise for your own building and you're trying to think about how you do it. Rather than think of a scenario first, think of the objectives that you want to test, and then we can find a scenario that will fit those objectives. The reason being is there are going to be a lot of objectives that are similar regardless of the type of scenario. It's just where we want to practice. That's where we think we need help with. That's how we design the objectives, and then we write a scenario to fit that. unfortunately, that's the way you're supposed to design an exercise. With the statewide exercise, the work group is given the what's called a MITEP, or multi-year training and exercise plan, from the federal government. So we don't really get a choice as to what we do. Your county may individually prioritize different things, and they may do something different than the statewide. But generally, those scenarios are picked for us from CMS. We try to, so when the scenarios picked us on the work group, we try to write objectives that are that fit within that scenario that we feel like industry would probably struggle with. And for us, since we're all relatively new at emergency management, unless we've gone through a disaster at our facility, you'll see the objectives that we've written for the statewide are on the basic side, but that doesn't mean that you can't create your own and things like that. So we can go on to the scenario.
Okay. So we put this as step 3, picking the scenario, because like Jason was talking about earlier, it's usually the objectives that are really what your response breaks down into, and those capabilities of activating your plan, activating communications, activating patient transfer agreements if you decide to evacuate. And really, there's a lot of different scenarios that you might end up evacuating or sheltering in place for. So that's why the scenario almost comes after determining what function you want to exercise on. Mm-hmm. So when you're putting together the timeline or a kind of narrative story of what you want your exercise to be, there's not really any specific format you have to use. So for our tabletops, we usually do a narrative format. The one that we're going to look at today, it's going to be an Excel spreadsheet with a inject-based timeline for all the different providers. So the cool thing is that this is already done for you, so we're not going to spend too much time on that.
Yeah, if you guys want to create a full-scale exercise, it's a lot of work. We're going to show you how all that stuff plays out, but nonetheless, it takes us a year to plan this. So we're starting on 2020 already for November of 2020. We began that process 3 months ago. So it literally takes us a year to do the whole thing. If you're going to plan to do this on your own, it's going to take you a significant amount of time to put all this stuff together. So if you choose to do your own, you certainly can, but you're going to spend 100 or 200 hours of staff time developing this stuff. So.
Yeah, so if you use the statewide exercise scenario, that's already done for you, like we said, but this 4th bullet point here, decide which departments need to be involved in the play. That is something that you're going to want to identify beforehand. Oops, it changed on us. So that you can make those scheduling and logistical decisions as to who you're going to include.
Yeah.
Okay, so it scooted us along to step 4, so planning logistics. We kind of touched on this already. Staff participation, if you're going to use volunteers or not. That's kind of an extra layer that you may or may not want to include. It's not outlined in the objectives. Roles of facilitator and evaluator and key staff. We touched on that a little bit. And that all of those roles are defined in the situation manual for the exercise. And then if you want to go back and review what a facilitator and evaluator is, you can actually go and watch. This picture here is a screen cap from a 15-minute training video that we did of how to actually run a full-scale exercise. It was filmed at a long-term care facility here in Sacramento. So that is available on our website or on our YouTube channel.
But you can see how many staff are assigned. It's when we say we want you to simulate the actual event, and that's exactly what we do. And so obviously you still have a business to run and you still have care to provide. So you're going to have to bring in extra staff in order to make sure that the residents still get taken care of and they're not impacted by the exercise, but also that you have staff that are not drawn away to go do that while they're doing the exercise. And the other part is we didn't mention the roles. We didn't talk about who would fill the role of facilitator or evaluator. But my recommendation is if you're an administrator, I would say step back and let your director of nursing or let other staff members. If you could bring somebody from the knock shift in, or you could bring people from the evening shift in, these are folks that don't necessarily get a chance to do these types of trainings. And I would much rather, I think it would be more impactful, and I think they would learn more if you get those folks in. And you, as an administrator, you step back and you watch what would happen if you were not in the building. So that's my recommendation. Certainly you can do it however you like.
Right. Oops. And then one more thing about this slide before we move on, the written materials and forms. So that is referring to the documents in the handouts, and then also the incident action plan. We're going to be reviewing that later on today, and you can find that on our website on our webpage for NICS, NHICS, and there's a link to that in the agenda. So lots of different resources. I couldn't fit them all in the handouts.
Yeah, and the written materials and forms are critical for survey. That's going to be your proof that you've done this stuff.
Yeah, and as you'll see as we go on, the objectives are also important because it really organizes your response across all these different documents, and we'll explain that a little bit further later. So actually conducting the exercise, so if you have the master scenario events list or MESL document printed out or pulled up in front of you, you can see as we start getting into this sort of spreadsheet or table where there's all these different columns going on, that first page is really just actually starting the exercise. So as you start looking line by line, and we'll explain this a little bit more, but there has to be some sort of actual initiation, whether you use the PA system or I don't know, you just start a clock, then that needs to happen.
Yeah, and the other thing I mentioned about evaluators, depending on how many players, meaning staff that you have participating in the exercise, you may need more than just one evaluator. You may need multiple evaluators or observers. But these are folks that do not get involved in the play of the exercise. They just watch and document. And so what they're looking for is when people did what, and document that. It's not to get people in trouble. It's just to identify things that maybe we could do better next time, or things that we're doing great this time. And then the facilitator at the end is going to be trying to capture all of those actions and look for those strengths and gaps, and that'll contribute to the after action report that's required.
Right. Okay. Sorry, the slides keep changing. Okay, so step 6. So after you have theoretically already gone through all the actions in the master scenario events list that we're going to cover in a little bit, then you would do sort of a report out with your staff or your participants of the exercise and get their feedback and see, what sort of things that might not ever cross your mind that you might learn from your staff. And these are some of the questions that you would want them to ask or to ask them. And then you can do a feedback form. We have templates for that. That photo there is all available on our website under exercises. And all of that is great documentation as well for the survey and when you go back to write that after action report.
Yeah, give yourself 15 minutes at the end of whenever you're planning on finishing the exercise to do this hot wash with all of the participants. And that way you'll capture the information. It'll help you fill out that after action report. So.
Okay. So we already mentioned this a little bit because it's something that you want to think about as you actually start the exercise. But again, just kind of recapping the requirements. So we've talked several times already about the after action report. That has sort of a companion document to it called the improvement plan. And that's really just another table that you will be plugging in things that went well, things that you need to improve, and then actually putting a date on it and assigning it to someone for it to be done. And we will talk about that at the very end of this webinar. Okay, so that brings us to the next part of our webinar. So once more, if you have not already checked out the handout section of GoToWebinar, or you can look under some of the emails that I've been sending out over the last day or so, you should be able to find a link to the master scenario events list. So again, this was put together by the exercise planning committee, Jason's on, and we might have a few other attendees today. Ashley Slight, if you're on the call, thank you for sending us this, and we will go ahead and take a look.
Yeah, so when you guys look at this is what you're going to use to drive when you do specific things. So on those on the master scenario of events list, it lists every single provider type. So it's acute hospitals, it's public health, it's fire departments, it's EMS, it's law enforcement, ambulances, you name it. They all have sections within this exercise. The way that you figure out what applies to you is on that fourth category where it says LTC and then it has a number after that. Those refer to objectives that you're going to be practicing. So if you see LTC in that category, that means that applies to you. If you're a long-term care provider, I should make that distinction. But if you're a long-term care provider, if you see that LTC, that means this is stuff that applies to us. So let's read it just as we go across. We say long-term care 4 or 3, which means that's the third or fourth objective we identified. When it says send from or assign staff, so it's assigned to long-term care, and you would be coordinating with the MOOC. So what happens here? Your facility has sustained significant damage to infrastructure and you no longer can care for residents in the current space. If that's the plan that you guys are doing, you're going to transition to evacuation, right? That's the plan. And so that's the fourth objective, and you go through the process after that. If you see LTC 3 and it says your facility has not sustained any damage, but you've made the decision to shelter in place, which is probably given the scenario, is probably what would most likely happen. But certainly you can practice the evacuation stuff. And then the actions over, expected actions over on the right, or what you should be doing during the exercise to simulate that response for that objective. So if we look at what it says is evaluate the need for evacuation, relocation, and or alternate care sites. And then facility will notify MOOC about status of decision to evacuate. Real simple thing, that's your actions that you're going to take to help meet that objective.
Right, so just to kind of back up there, so when Jason's talking about these LTC 4 or LTC 3 in the column for objectives, that information you're going to find on the other handout that's titled objectives. And so I apologize, we should have probably put these slides before that. So when you see LTC 3, we're actually looking at page 2 of the objectives document where you'll see it says objective 3. And so as you read across this, you'll see LTC 3 is when you're going to shelter in place, and that corresponds to the other document. And so, again, this is just important for being able to kind of get through the entire exercise and knowing how, when you're working with the statewide exercise and all these other agencies and these provider types, that this is kind of how they fit everyone in together. So this slide that we're still looking at here, that's going to be page 8 of the master scenario events list. And so as you can see, that should be highlighted in the document that you have under handouts. And again, so like Jason was saying, this is kind of your timeline for how your response would unfold as if your facility is being flooded, or maybe if you decide that you're not going to be flooding, but you're just going to be sheltering in place. This is kind of where you would start looking at your own facilities procedures for flooding and kind of taking out your own emergency operations plan and starting to see, how would I respond to this prompt that's in this sort of master document that everybody's going to be working off of.
Right. It's really, this scenario is really leading you to 2 different distinct choices. And you're going to have to make a decision before you start exercising, unless you really want to challenge your staff and change it in the middle of the exercise, which I don't recommend until you've got this really down. But pick shelter in place, pick evacuation, have all your checklists, have your EOP out and ready to go so that your staff know what kind of actions they need to respond to. If you don't have checklists or some kind of response, quick action response guide for your staff, Print off your flood policies and procedures from your EOP and have that available for the staff as they do the exercise, because they're not going to have this stuff committed to memory. So
right. And just a quick note, I should have prefaced with this, but if you are an LA County provider, you're going to have a different events list to go off of, because LA County has a different.
It'll look just like this.
Yeah, it'll look really similar. All the objectives will be the same, but the way that you communicate with the county is a little bit different.
For sure. Yeah, and it'll be different in each county. Some counties have online systems. Some counties want you to call. Some want you to email. You're going to have to figure that out before the exercise happens. So coordinate with your healthcare coalition and your local MOOC to find out how you coordinate the exercise.
Right. Okay. Let's go ahead and check the questions box, because I know that this is like the hardest part. So let me go ahead and open this, because I don't want to get to the end.
And there's a fifth category that says TJC and CMS, yada yada, and you'll see a bunch of code numbers. That just applies to what CMS requirement these specific objectives meet. So.
Okay, so we have a couple comments. So someone is asking, how do we know if we will get LTC Objective 3, which would be sheltering in place, or 4, which is evacuation, in the scenario? Do we choose, or will the MOOC tell us?
No, you'll choose, and so you choose based on what you think is most, what you think you would struggle with the most. That's what we would want to practice on. For most of us, it would be evacuation, because it's a broader things of actions that need to happen in order for that to go smoothly. Shelter in place is a great one. You can do that as well. Especially if you've never taken evacuees, it would be good to exercise that to know kind of the limitations of what people are going to get transferred with and stuff like that. If you're going to shelter in place, you're going to coordinate with the MOOC. The MOOC, depending on the county, may simulate sending you residents or facilitating a transfer of folks from another facility to yours. It's just going to depend on the county if they want to do that. But for you, you get to choose evacuation and shelter place and figure out what's gonna challenge you the most and do that.
And then he also wants to know if you are in ICF, we are in the long-term care category.
That's correct. Yes. And as sad as it is, this requirement is exactly the same for ICFs as it is for skilled nursing facilities. It hardly seems fair that you have 4 staff and you're expected to do the same thing as somebody with 100 staff. So, but it is the same requirement.
Okay, and then one other comment, the link to the incident action plan is not working, so I will send that out again after we're done here. And then if you look on the agenda, you can also find that under the link on the agenda for CAHFDisasterPrep.com/NICS. That's one of our NICS forms, and we'll talk about that in just a second. Okay, so we're going to do questions at the end.
Yeah, and let's talk about that incident action plan, because I think that's the next slide.
Okay, great. Okay, so we've talked about objectives. We have the Word doc that's got all your objectives lined out for you, because the state put that together. So what are you actually using to document your exercise response? Because the MEASL, the master scenario events list, that's just a timeline. So how are you going to be documenting what your own staff is going to be doing? So this form here is from our Incident Action Plan Quick Start. This is from our nursing home Incident Command System, or NICS document. And we have all this stuff online at that link I just mentioned, CAHFDisasterPrep.com/NICS. And so as you go through, so hopefully you would have identified your objectives beforehand, and so you can go ahead and add those in. And then you want to look at your own emergency operations plan and identify what strategies you have in your plans for meeting those objectives, such as activating communications or sheltering in place, evacuation, etc.
And the tactics could be the same as your procedure. So the objectives we've already created for you. You have 5 objectives there. You're probably only going to use at most 4 of them, because one shelter in one place and one's evacuation. So you put that objective into that box where it says objectives. And then you talk about, okay, so if this is my objective, how am I going to meet that objective? What are the procedures that I've identified in my emergency operations plan that I'm going to do in order to meet those objectives? So let's say one is shelter in place. That's an objective. What are the strategies? Well, one of the tactics I'm going to use is I'm going to send my my maintenance director around the building to assure the building's safe to occupy. So he would physically do a safety check of the building to make sure ingress and egress out of the building is okay, parking is okay, getting in and out. If we had to get ambulances in here, that's okay. All of those things that they would do, that's a part of those strategies and tactics. What resources does that maintenance person need? Well, this is a daytime activation, so you probably wouldn't need a flashlight, but that would be an example of something, a resource that you could do. Maybe a camera, so you could, or a phone, so you could take pictures of anything that you had questions about, stuff like that. Those are tools that they would need in order to meet those objectives, right? So, and then who is it assigned to, that last category? And we're going to show you what this looks like completely filled out. So you got an idea of exactly what you're going to be doing come the exercise time.
Okay, so now we're kind of just going to do a quick overview of what the actual objectives are, and these sample tasks here can be examples of some of those strategies or tactics. So we're going to go through these really quickly because you already have the hard copy or the handout. So, and then we're going to show you what that previous form looks like completed with all these objectives in it.
Yeah, so first objective is just to activate your emergency operations plan. This is a standard objective, so everybody's gonna do this if you're gonna participate.
Mm-hmm. Objective 2, so activating your communications. This is also kind of like situational awareness. So this is a twofold thing. You know, how are you going to be getting information to make more informed decisions? And then who are you going to be communicating with about your operational status, your staff, residents, families, all those different people that need to be notified if you activate your emergency operations.
Yeah, and I'll say this is a great one that in real life we don't do real well with, especially that very first bullet point is that information sharing process. You know, most of you guys are aware that, you know, half the states getting their power shut off on an ongoing basis. We've got a large fire burning in Northern California with a bunch of providers impacted. When you as a provider don't provide that information to your local response partners and to the licensing office, there's a big question as to what the status is of your building and do we need to assist you, and especially when phone lines or communication is compromised. This is incredibly important because we don't know what you guys will need, and believe it or not, there's a reason why the licensing asks you to call for these things. And eventually, CAHF will get that information and we'll reach out to help you if you're in need. And so it's important. We won't know that unless you're contacting those folks at licensing and let them know of your status. So that part of this exercise you should be really practicing. Who are you going to call at your county? What is the method in which they want you to call them? Everybody should have the state licensing district office listed in there. And that's just a process of calling and saying, hey, we're participating in the statewide medical health exercise. We're simulating our responses as a drill. Our facility is currently impacted by the flood, but we don't need to evacuate. We're self-sufficient, or whatever method you want to tell them, whatever it is, just practice the method of communicating with them. So that is a really important one, but that's an example of information sharing going out. But Cortney mentioned, how are you going to get information in? So are you going to assign somebody to monitor social media like Twitter? There's going to be a hashtag for whatever flood or fire or whatever natural disaster it is. Use that as a process to gather timely, up-to-date information. Are you coordinating with your local community? Is your community setting up a time, like a daily call, where you could call in to find out the status of what's going on? There are all these things that we want you guys to kind of practice, and that's a part of this communication piece in the exercise. So the next, did you have anything else on that? And then it's also the bed capacity. I failed to mention that's probably one of the most important things is I'm sure many of you people have over this last weekend or this last 2 days have gotten requests for bed capacity. Activating that and letting folks know from the county how many available beds you have if you're going to shelter in place, or if you're evacuating, how many beds you need. So.
Right, and just a note on that on current events, because this has come up recently. If you get a call about placing people in your nursing home, it's a 30-day transfer, so like you shouldn't have to worry about whether or not they're being fully discharged. We just hear about people trying to evacuate and they're calling around, and the other nursing homes are asking like, will send an inquiry, or are they like Medi-Cal? And that's not how CMS or CDPH is wanting that to work. And so just know that, if you want to learn more about evacuation and how all that stuff works, that's a whole other discussion. But
yeah, I always what I try to tell people, that if you're ever wondering about what you should take with you or send with your residents when you evacuate, just do an exercise and practice shelter in place, and practice what would come from with a resident, like the onboard, the admissions process, or however you're going to do it. Understand that there may be limitations in what they send. So if you understand it from a shelter in place side, you know what you should be sending from an evacuation side. If you want a checklist of what should go with each person, we've got those. Something real easy. One page, here you go. Hand that to a CNA, make sure everything's in the packet, check it off the box, and you're ready to go. That part is pretty easy, but I don't think people realize how difficult it is to take evacuees, because there's a lot of stuff that needs to go with them. Staff, stuff, supplies, food, water, medications, all that good stuff. All right, we could.
Okay, so we've got just under 20 more minutes. We're going to try and get through all these so we can get to the questions. So sorry to get off topic here. So, okay, objective number 3. So this is kind of where you get into like the choose your own adventure stuff. Like you can like decide to shelter in place or evacuate.
Yeah.
If you decide to shelter in place, you can still be sort of preparing to evacuate. Like Jason was saying, you could make it one of your objectives, or a way to involve your CNAs is like, how do you assemble go kits? What needs to go inside them? That's a really great exercise in itself for doing the functional or full scale boots on the ground stuff.
Yeah, and if you really want, if you're really a go-getter, you could say, hey, I know my sister facility in city A is 20 miles away. They're going to pretend they're going to evacuate. I'm going to pretend I'm sheltering in place, and I'm going to surge those residents into my dining room. And I'm going to figure out how I'm going to place them there. I'm going to figure out, do I need like an awning set out front, or is there a place for, to do an admissions, or, these folks to get them into the building. Think about what that process would look like in real life, and then set it up and do it. I think that's a great way. Plus, you'll practice activating your agreements or transfer agreements. All those things would be great to do. Doesn't mean you have to do that, but certainly that could be one method. But I want you, if you're going to shelter in place, think about what you're going to ask the providers that are sending you people, of what they should, what you need from them in order to take them as a resident. Most of the time, the counties are pretty good about sending you folks, and they're going to send you the stuff with it, but it doesn't always happen that way. So practice that understanding, and then letting either the MOAC or the evacuating facility who's sending you residents, let them know what you need. That's those critical resources, because they're going to try to send you everything they can, food, briefs, medication, all that stuff. But is there something in there which these new residents are going to put a strain on your supplies? And then figuring out how long you can withstand with your current supply limit, given that you now have 20 extra residents and 10 extra staff or 5 extra staff. You got 25 extra people in your building. How long are those supplies going to hold out? And
Yeah.
then we can tap into the communication plan in order to ask for those resources from the county or another vendor or something like that.
Yep.
All right. So
okay, so the other side of that coin. Oh wait, we had an extra slide for evacuation. Oh no, wait.
No, that's it.
Okay, sorry, got confused. So if you decide to evacuate, then we kind of already touched on this. Jason said, you'd be activating your patient transfer agreements with your sister facilities, or the county might be assisting you at that point in finding beds. And all of that's going to rely on that ongoing communication. That was your second objective there.
Yeah.
And so it'll be worth knowing if your county uses a bed pulling system like ReadyNet or EM Resource or some other platforms out there, or if they want you to be reporting this all by email or by phone. And then imagine how you would be doing that if there was a flood or your utilities are out. So if you've gone through a power shutoff already, then unfortunately, it could be good practice for a situation like this.
And the big one that we don't gosh, a lot of folks are running into in the last few years, especially as it relates to fires with floods. You're kind of in it or you're not in it. But if you're evacuating and time is of the essence, you're not going to be able to secure beds for these folks. And I'm just telling you that it's good. If somebody tells you that you got 2 hours to get out of your building, you're going to have a hard time finding transportation to get them out within that 2 hours, much less find them beds for them to go. So what you've got to do, and it depends on how you want to practice, but I would say if you've not already identified a collection point or some other site where you can go to keep people out of harm's way in order to figure out the beds where they're going to go. That's what I think you should be practicing, because all of these folks that are evacuating from these fires, it's not a planned or a smooth process. It's a process where they have to take them to a staging area and then wait in the staging area until they can find them the beds. So that's the part, this initial response to evacuation, I think you guys should be thinking of. And if you've not identified those sites, it's something you can do see if you can do it during the exercise if you want. If you go, well, I haven't done this, but let's pretend like we had to do it right now. Where around your building could you stage? Is there a school parking lot or a park, someplace where you can get ambulances in and out of, or wheelchair buses, things like that? Coordinate that with your local response authorities. They may have a place where they want you to go stage. All that stuff we'll need to figure out beforehand. But if you want to practice evacuation, it's literally thinking about all that stuff. But it's also setting up the canopy outside. It's staging or creating a staging area to load people onto the transportation in a timely manner. It's all of those things need to be considered, and you should be doing that in your exercise in the first 4 hours of this exercise. If you're going to do evacuation, that's really what it boils down to.
Right.
So.
All right, let's do our last objective, and then we will take a look at questions and keep up on those. We had another slide for evacuation. So these are just more examples. Again, these are all just pulled right out of that document that's titled Objectives. So I won't spend too much time on this because I want to make sure we get to everything today. So our last objective, just real quick. So the multi-year plans, they're trying to incorporate mental health.
Every year we have that.
Every year, yeah. And so this kind of ties into recovery as well.
It doesn't mean that you guys have to do this objective.
Right. But it's important to know that you can request mental health support resources through the MOOC. And again, this extends to your staff, residents. Is there anything else you want to add to this?
Yeah, and a lot of company health plans have the counseling program, EAP, or employee assistance programs within it. So you can practice activating those things. There's a lot to do in the first 2 or 3 objectives here. I'm not sure you're going to get to it in it. And in reality, in an actual event, these resources probably would not, there wouldn't be a ton of these resources out there available to you within the first couple hours of any event. This is generally something that happens during the ongoing response or the recovery phase.
Yeah. We do have a video about psychological first aid if this is something that you want to learn more about. And we are going to be offering CEs for that eventually. We have a 50-minute long video with some quiz. It's designed for CNAs if this is something you want to incorporate. And it applies to all sorts of hazards, everything from active shooter to, the end of the alphabet.
Yeah, exactly. Zombies.
Zombies is what we say in emergency management. Okay. Enough of that. Okay, so before we move on to this, so while I look at the questions, if everyone just kind of wants to take a look at this, so this is how everything that we just talked about would kind of plug into the incident action plan.
Yeah, so objective 1, we've got activation, strategies and tactics. Activate EOP within X time of incident notification, identified staffing needs, and activate staff members as needed. Those are kind of examples of strategies and tactics that we would use in order to meet that. And then resources required, phone, computer, those types of things. Objective 2, communication, obviously the phone, we need resource. Coordinate with your local response partner. Inform agencies of operational status. And so when we say operational status, we really need to know kind of, 1, are you okay and can you accept residents? 2, you're okay but you cannot accept residents. 3, you're okay and you need assistance. 4, you're not okay. You're black, everybody's evacuated out of the building. So there's kind of a process that they go through. Each county does it a little bit different, but it's normally a kind of a color-coded thing, like green, you're good, red, you're bad, black, really bad, yellow, caution. That's kind of how it goes.
Okay, so we have a couple questions about this section before we move on. So someone asked, how do we communicate simulation versus actual during the drill for communication to the community agencies? So just all caps say, this is a drill, this is an exercise at the beginning and end of all messages.
Yeah, and put up signs at the front of the building where the entrance is that says exercise in progress, or we will be conducting an exercise during this time. That we're simulating our response to a disaster. If you have a social media page, like a Facebook page or something like that, I would post and say, on this day, we'll be practicing our disaster exercise. Certainly you can, but those notifications, talk to resident council, let them know what day you're going to do it on, and let them kind of indicate how they should message the residents to let them know. But for visitors to the building, have signage up so that they don't confuse your actions with an actual response.
Right. Someone asked for objective number 2, communication. Do we communicate using sit reps even though we are okay? So if you're signed up for your county's exercise, then you should be getting some kind of alert or initiation that the exercise has started.
But even if you don't, if you're participating and they're participating, send them a situation report and just let them know whatever it is you're planning on. If you're planning on practicing shelter in place, just let them know we're green, we're okay, or we're yellow, we can't take residents, or however you want to do it. But you're definitely going to send them a situation report, regardless of whether you're practicing evacuation or shelter in place.
Right. And so for counties that don't use the bed pulling platforms and they just want you to use email, so you would be emailing that information to the MOOC.
Yeah.
And then if you are in a county that uses something like ReadyNet, then you would be logging into your ReadyNet account, or hopefully you're getting the notifications on your phone.
Yeah.
Okay. And so also whenever you start seeing real life or an exercise that you're going into emergency operations, go ahead and alert the county, because the earlier you can start those emergency communications with them, it doesn't matter if it's a real event or the exercise, they want you to alert them as soon as possible, even if, like this question is asking, you think you're going to be okay.
Yeah, and we never take that, like when I was talking earlier about notifying licensing and the MOA program. That it's really important, even if to tell us you're great, because it also lets us know, one, we don't have to dedicate any resources to coming to help you out, at least for the time being, and two, it also knows that you may be able to assist other providers if we find a need. So definitely situation report, good, bad, doesn't matter. We need it.
And then one more question before we move on. What is a reasonable time frame to document in the objectives? So if you look at the master scenario events list, there should be a column. If you look on the top at the orange bar, it'll say inject time, actual time. And so there you can see what the timestamp is for each of these actions. And again, the objectives column will tell you at what time you should be starting to focus on those different objectives.
Yeah, and every county will have a different start and end time, but really this is going to be 4 hours. It's going to be either from 9 to 1, from 8 to 12. Everything you're going to do has to fit in that time. So that's going to limit the amount of what you can get done in 4 hours. But yeah, Courtney's right in terms of the time frames. It's all there. The objectives, you can create your own objectives. All we do with the statewide medical health exercise is create objectives for you to use, so you don't have to think those up. So by all means, if you come up with 6 more objectives you want to test, go right ahead. You can fill those into the incident action plan and use that as a basis for creating your exercise documents. But if you want, just put the objectives that are on the exercise plan and put them right into this form.
Right. Okay, so we've only got a couple more minutes. We might go over today, but we're pretty close to being done, so bear with us here. Oops, if I could then work the computer. There we go. So the incident action plan, we mentioned it's part of this larger system that has a lot more of these different forms that you can use to address some of these. We have staffing tracking lists, all of the sort of checklists for evacuation that Jason was mentioning earlier. There's the link where you can find this webpage, and then again, the link to this can be found on the agenda under handouts. So this is going to be something that you'll see on the incident action plan as well. We don't really have time to kind of get into this, but if you go check out our videos page, we do have several videos where we talk about the incident management team, incident command itself, and kind of what all these different people do. But I think as long as you kind of get down the objectives and you understand how to read the measle, or at least kind of understand what implementing your flood procedures at your building would look like, then you should be in good shape. But again, we just did a whole day training for LA on just NICS, so it's a lot.
It's a lot.
Anyway,
we couldn't cover it in one slide for sure.
And I'm so sorry. I wish we could, but I want to get to your questions as well. So lastly, so everything that you do for your exercise, you'll need to capture in this after action report and improvement plan. So the after action report, again, you can draw that from your participant feedback forms. You know, what are 3 things you did well? What are 3 things that need improvement? Maybe a short narrative of what you did and what time you started, and you can draw that information from the measle document as well.
Yeah.
Maybe outline what your objectives were. And then this green cap here is actually of the improvement plans. So again, it's just like another table that's kind of breaking down the same things. I usually just pull the sentences straight out of the report and plug it into the improvement plan, just like we do for the incident action plan.
Right. So this is the thing that we're missing, that most of the providers are not completing. It's not that they're not going to the exercises or not doing the exercises or attending the exercises. It's that last little piece of bringing it all together in the form of the after action report. After action report is just that narrative based thing that talks about what the exercise is, what we did well, what we did wrong, that kind of stuff. This is going to be required for you to show proof that you captured information from the exercise that's going to affect this improvement plan. An improvement plan is a timeline of when you're going to address those changes. We should cap the changes at 3. Especially if they're large changes, it may take you a while to do it. And give yourself 60 days on the end of the exercise to complete the after action report. Some counties may want it sooner than that, and if the county wants you to send it in sooner than that, do it as soon as you can. You can take that scenario information directly from the measle and slap it right into this after action report, because that's the scenario that you tested.
Yeah, and that's why we talk so much about the objectives, because you can see when you get to the end, it's the same stuff for the 3rd time,
Yep.
So it's really not that hard once you get the hang of it. And again, if you have any more questions about how to plug this all together, you can shoot us an email or give me a call, and I'm happy to walk you through it again.
Yeah, and I want to just recap. So in terms of the paperwork you guys are keeping, you're keeping the exercise plan, which comes from the county or from the state. You're keeping that measle, which is the master scenario of events list. You're keeping your incident action plan as proof of what you did during the exercise, and then you're keeping the after action report and improvement plan. So those 4 sets of documents are what you're going to need in order to provide proof to that surveyor that you guys have completed the exercise. You've done the full thing. Now, if your survey comes up in the middle of you doing that after action report and an improvement plan, you can let the surveyor know that traditionally you're given 60 days to complete that at the end of the exercise. So.
Okie doke. So somebody saw a sneak peek of our next slide. Just really quick, Jason kind of already touched on this, but make sure that you keep 3 years of after action reports. Yeah. And then you will need separate after action reports for your full scale, and then your second annual exercise, which people usually do a tabletop.
Right. And so that means, and I know a lot of you guys have come to CAHF tabletops, or you go to a tabletop by your county or by your healthcare coalition. CMS has said that will work for the exercise requirements, but all of those documents you're still going to have to do. And so when you go to somebody else's tabletop exercise, you're going to have to bring that information back and test it against your own plan, because it's the exercise is about talking through it, but also testing your individual capability to meet these scenarios. So you still need to have the exercise plan, still need to have a measles, still need to have an incident action plan, still need an after action report. So those 4 things are going to be required, whether it's a tabletop or a full scale.
Right. Okay. Oop. So recap. So what do you need to do to satisfy your exercise requirement? You'll need to conduct a full-scale community-based exercise, which is what the statewide is. So that's great. If everybody suddenly has to cancel because of wildfires, you'd still be on the hook for doing a facility-based exercise. Yeah. So we kind of touched on that earlier, but just want to reiterate.
Now, there's one little caveat, and this may apply to more of us than we know, but if you guys have a real-life emergency which caused you to activate your emergency plan, and that can be anything from something as small as having a power outage for 3 days because you were in the PG&E footprint, to wildfire or evacuation or shelter in place or any major thing. As long as you're capturing the information in the same format that we talked about exercises. So
incident action plan, after action report. I'm sorry, it keeps changing.
Incident action plan and the after action report with a description of what happened, things that you identified that you can do better, and then that improvement plan, which assigns the improvements to a specific person.
Right. So chances are, if your county had to cancel because of an activation or a real life incident, you could probably be activating your own shelter in place procedures and then just kind of continuing with what you were already planning to do and capturing it like Jason was describing.
Yeah, or you could change it to a tabletop, and you could do it as a tabletop. The point is, if you have activated your emergency plan during a real life emergency, you've got some lessons learned. I would work on those as
right.
first.
Okay. I think that this was kind of just a nice slide that we don't really need anymore. All right, so this is our contact information. I'm going to leave this up while I pull up our questions. I really appreciate everyone hanging out with us past 2 o'clock, so let me give this a look. Could you please repeat what the documents are again that we should save to show compliance?
Exercise plan. So that's the main the document that you see on the statewide medical health exercise. The MESL, M-S-E-L, or Master Scenario of Events List. And that's that spreadsheet that's
in the handout.
Incident action plan. Now, this is something that we use to capture the information in the method that we showed you. You don't have to use an incident action plan, but you would have to use some other type of form to capture the information of objectives, strategies and tactics, resources required, and the person that it was assigned to.
I will send that form out after our webinar is over. I apologize that the link was broken, so incident action plan will be emailed out after.
Yeah.
Was there anything else?
The after action report and improvement plan. And so that all of the 2 forms, the exercise plan and the MESL, those come from the state. And so your individual county will send those out based on the county that the scenario they're using for the county. Not every county uses the same scenario. The incident action plan and the after action report and improvement plan, both of those are documents you will create, and the format is on our website. You can download those. Those are things that you're going to keep, that we've created for you. You're going to fill them out and keep those as records for survey.
Okay, so let's see. Someone asked again, how long do we keep these? So you'll want to keep them for 3 years back.
Yeah, that's what our audit requirements are 3 years. Certainly, you could talk to your risk management company and ask them if they need you to capture that information for longer. Maybe they want you to hold on to it for 5 years, but 3 years is traditional for us.
And then one last question, will we be given the webinar evaluation form for Cortney? So that is actually under handouts right now. I will make a note to send that out to the attendees afterward as well, because I know that sometimes people have trouble accessing the handouts.
Yeah, and there's one last question here. It says, is just 1 full scale and 1 tabletop, or 2 full scales and 1 tabletop? It's 1 full scale, 1 tabletop.
Can you just say the 4 forms needed for compliance one more time?
Sure. Exercise plan, master scenario of events list, incident action plan, and the after action report. The after action report is a 2-part thing. It has the improvement plan attached to it, but it's the after action report improvement plan.
And so for that first document that Jason mentioned, the exercise plan, that's kind of like the master document, and it's not one of our handouts today, but you can find it on the CDPH website. So if you go on the agenda.
Well, I want to caution you guys away from that. Talk to your individual county. The reason being is because not every county does the same scenario. So Sacramento County is doing a different scenario than the state. LA County is doing a different scenario. So your exercise plan will be different based on what your county is doing. Most of them do the same thing, so you can just go to the state, but just double check to make sure they're doing the same scenario, because Sacramento, has prioritized doing a mass casualty incident with adolescents or with children. So it's like the exercise plan would look completely different for them versus what it is for Stanislaus County, which is doing flood, or LA or whatever.
Yeah.
So.
But the basic scenario that we talked about today, that's going to be on the first page of the master scenario events list, and that was one of our handouts for today.
Right.
So let's see. So someone asked, if the exercise plan is different, then will we need to get a different MESL?
Correct, yes. So if your county, meaning, specifically Sacramento, because I know they're different, Sacramento has created its own MESL to go with that scenario that they created. So now I don't sit on the work group for every county. So I only do the state, and I do Los Angeles. So I wrote the objectives for the state one and the Los Angeles one, but we don't know what the exercises are for other counties if they have chosen to do a different exercise. Most, like I said, choose to do the main one. So it should be the same. But if they've changed the scenario, they will also have to change their measle.
Yeah, at the very least, the objectives should be the same on that document for objectives, and then you can apply whatever localized flooding would look like. Or you can just use the statewide one. So the statewide one is kind of like the baseline or backup if your county decides to not customize it.
Yeah.
And so if you haven't already contacted your county MOAC or your healthcare coalition coordinator, if you go on our website, we have a web page and it's under resources. So, or you can just go to cahfdisasterprep.com/county, and the link for this is on the agenda. So on the agenda, it has more links where you can find all this stuff. Go ahead and try and contact your healthcare county coalition, because they'll be the ones running that exercise. And if they are customizing it, then they'll have those documents.
All right. So how does this work for a home care setting when care is provided for the client's home? So home health has a different, home health and hospice have different objectives and different, and I'm not sure if there are objectives that were written into the measle or injects that were written into the measle for home health and hospice. There's nobody from the home health hospice industry that sits on the work group. So it's kind of the folks at public health and some of the committee members are responsible for filling those out. And I got to be honest with you, I'm not sure how well built out it is for those two settings. I know the long-term care is a little bit better. So, yeah. All right. Do we have any other questions?
Let me double check that we don't have any more questions. So going once on questions before we wrap it up for today. We're just scrolling, making sure we got to everyone.
And if you guys missed anything, we're recording this. We're going to put it back. We'll put it up on YouTube. It'll be available for free for you guys to refer back to if you need it.
Yeah.
Or if you want to have your staff watch it, certainly as well.
Yeah, and I will email out all the links one more time with the correct link for the incident action plan and the evaluation. How can hospice join in this committee? You'd have to shoot Jason an email and
yeah,
he could
you know
direct
what?
you.
That's actually good. We're always looking for other healthcare providers to sit on the work group. So if you email me your contact information, I will take it to the committee. I think we meet again next week for the 2020 exercise. Email me and I'll see if I can get you on the work group or at least coordinate with you.
Yeah. Okay. Alrighty, so I'm going to put the mic on mute. I will be on here for a couple more minutes in case anyone has any more questions, but I think Jason's going to head back to his desk.
Yes. Thank you very much, guys. Best of luck. Don't hesitate to reach out to either one of us if you have questions about how to exercise, plan this exercise or any exercise.
Okay, thank you.